Okay, everyone, welcome back to the 2023 Telehealth Summit brought to you by CTRC. We are glad you can join us for day 2. I am Aislinn Taylor, the program specialist at the CTRC, and I will be moderating this session today. As a reminder, this session is only for informational purposes. The California Telehealth Resource Center has no relevant financial interest, arrangement, or affiliation with any products or services discussed during the Telehealth Summit. Before we begin, just a few tips for the platforms we're using today. Whova makes it super easy to connect with attendees. So if you're not on there, definitely recommend getting on there, getting involved in some chats, checking out the conversations and resources being shared. We also have questions that you can ask in the Whova chat window. You're also welcome to use the Zoom chat to ask your questions here. We also want to remind you that closed captioning is enabled. So if you would like to view subtitles or a transcript, you can access them via the live transcript icon in your Zoom control bar. Lastly, I want to remind you that the session will be recorded and it will be made available through Whova and CTRC's YouTube channel sometime by this end of this month. So with that, I would like to introduce our guest speaker for today's session, Telehealth for Vulnerable Populations, Dr. Sebastian from the North Carolina Office of Rural Health. Sebastian is an experienced healthcare executive, researcher, physician, educator, visionary, population health, broadband, digital equity, and telehealth advocate. Mr. Gimenez, the floor is yours.
Okay, thank you very much. Good morning, everybody. We can go to the next slide. This is the topics that I'm gonna talk with you today. And I just want to, before that, I just want to mention some things about our team. I'm from the Health Information Technology team with the Office of Rural Health of North Carolina. We are a division of the Health and Human Service Department. And rural health in this case is equal to vulnerable populations. As you know, anything related with rural populations, they have a disadvantage, and one of the disadvantages is in healthcare. Our Office of Rural Health was created in 1973, so that's make our office the first one in the nation. Nowadays, we have one Office of Rural Health in each state, and that's most of the time depends from the Health and Human Service Department of that state. And North Carolina was the first one, so, and this year we're gonna have our 50th birthday. So big celebration, and that's what it make this Office of Rural Health a little more special, or with a little more resources, because we have this team that I'm a member, the Health Information Technology team, and that one of the first big fields and the big areas for our team, it was anything related with telehealth. So I hope we have enough from my team. What we're doing is so many things right now. We're pretty much covering every field, but our office, what is putting, for example, money with grants is with everything related to behavioral health. Actually, our first experience in telehealth in the state was around 2013 with a program called NC STEP, that it was a program between the Office of Rural Health and East Carolina University in North Carolina. And that was the first statewide telepsychiatry program. That was the first, the beginning of telehealth. I don't know if you remember all these huge equipments, all these big machines, and that at the beginning it was designated pretty much for psychiatry emergencies in the emergency room. And over the years start to evolve to many other different things, and right now they are doing just regular psychiatry and behavioral health. So that was like the beginning of telehealth in North Carolina. And right now my team, because they have different teams in our office, and right now my team is dealing with a grant for hospitals that they didn't have telehealth, so they have like something basic to improve. It's like to a maximum of $1.5 million for the hospital they were selected. At this time there are 7. So that's our current project. Okay, here we have some considerations about telehealth that I don't want to get into details because I'm sure that everybody's familiar with that. Is digital literacy, equipment, and broadband. I put this thing through this here because that's pretty much in the program that you're trying to establish. You're gonna need these 3 areas. So that means like apply for grants, apply for people that they deal in these areas, because they're all connected. They're like you cannot miss one of them. I mean, of course, digital literacy related to the patients. Equipment is especially for vulnerable populations. That can be phones, that can be hotspot, or that can be laptops or tablets. And broadband is, we will see more in advance in the presentation how important it is and how our office is working with other departments for the government, like the DIT, that is the Department of Information Technology. Okay, next slide, please. Okay, this is like a definition from vulnerable populations from the National Institute of Health. You can read here, I can read for you: patients who are racial or ethnic minorities, children, elderly, socioeconomically disadvantaged, underinsured, or those with certain medical condition. So that also includes the rural populations. That's why we have our team. Okay, next slide. This is some vulnerable stats from North Carolina. This is from the CDC, and you can see some numbers here. I mean, I don't have the numbers to compare with California, but this is something interesting to see. And I don't know if I mentioned before, but North Carolina is the 2nd largest in population state in the nation after Texas. So that's makes sense for our office in that case. Okay, next slide, please. Pretty much like any other advantage of telehealth in general, but in this case for rural vulnerable populations, is increased access. The first team for our office in the 1973, the first task for the Office of Rural Health, it was relocate doctors in rural areas. So with increasing any kind of benefits, like special programs, loan repayment, special visas, and any kind of program to facilitate foreign doctors to practice in those areas. That was the first task. So telehealth, it will definitely improve that that need. Okay, reduce travel burdens. As you know, I'm sure like California being one of the largest state, they have like similar things. Like patient, they have to drive for hours to see an specialist that probably goes once a week to the office. So that's another need that is covered. Timely and efficient care. I mean, time is important, so everybody is happy with that. Continuity of care, health education and prevention and preventive care, collaborative care, and remote monitoring. So that's what we call RPM. I'm sure everybody's familiar. So we are working also in these areas. We have many experiences with rural health centers that they depend on our office for especially high blood pressure, diabetes, and weight control. Okay, next slide, please. Here should be a link. I think that you're gonna have like the slides available. My team, we created this North Carolina Telehealth Playbook. That's pretty much for providers that they want to start a telehealth program, and probably for big health systems, they will say, oh, you know, they have their own department things, and probably for a lot of you, it could be like a little basic. But this is, I mean, North Carolina has like a lot of like a small clinics and small organizations that they need this kind of assistance. So I think it's going to be at the end of the presentation, when you can get the slides, that link should be there. So and it's also in our website and in the website of the North Carolina Health and Human Service Department website. Next. We have another part of the website that pretty much focus, same as the playbook, in anything related with that. At some point, we were thinking about like working a certification, not just because it's necessary, but that's really motivating for the staff, especially for anything, anybody related in a clinic related to telehealth. It will be motivating to have some kind of certification, some training. So that's one of our plans, and that unfortunately after COVID, all of these plans they were like they're coming back to the work stream again, because we were busy for 3 years with the pandemic, and also using more telehealth. So that's one of the benefits of the pandemic. So that link is going to be provided in the slides, in the links. So next slide, please. Okay. As we mentioned before, digital literacy is one of the main areas. You will see anything related from the federal government, even probably from your own state. Everything is related to this. So my team, we were granted a grant from the Department of Information Technology to use resources in this area. So right now we are all working in planning how we're going to use that money for educate patients with basic stuff. I mean, we were all like talking about telehealth for a long time, but I had experience by my own in telehealth that it was like, I say, this is complicated, this is confusing. So I can imagine for someone who doesn't have the basic digital literacy, how complicated it is. So we're gonna try to go from the basics and try to use the resource from this grant for digital literacy. Let me see 1 second. Okay, so I don't know if I guess everybody can see the screen, so I don't want to go to everything, but I just want to mention, just in case someone is in the phone, that digital literacy includes informational literacy, definitional diversity, ability to use equipment, defined differently according to age, occupation, ability to use software, reflection on the impact of the media. So anything, even like a cybersecurity, we're trying to cover absolutely anything related to digital literacy, because even if we think we know, sometimes it can be complicated even for us. So next slide, please. Broadband access, as we mentioned at the beginning, this is like one of the big areas that affects especially the rural populations. So I can't remember exactly what is the number that they find under served in broadband. So it's like a number, probably someone is going to remind me, but our office worked like directly with the this office called the Broadband Infrastructure Office from the Department of Information Technology. So we created a group that is like the Digital Access Coalition, or the Digital Equity Coalition. So that's different organizations from the government, private organizations, and many other different institutions that they try to work only in this area. And I can talk a lot about this. I mean, we're going to different meetings in the rural areas. I mean, not just with webinars. We just go there. We do some little city halls, and we learn absolutely a lot. We're just creating a resource, a list of different resources that we have there. Only when you go there that you can learn what are the needs of the people. And also we get information about like mapping. I mean, because we need to know exactly what are the areas. So the Department of Information Technology, they're changing the map and updating the internet access constantly. So we can go to the next slide. Okay, that's what I was mentioned before. The Broadband Infrastructure Office is a division inside the Department of Information Technology, and as probably you know, from federal funds, they're receiving a lot of different grants, money to increase the broadband in the state. In this case, for the use of telehealth. Okay, we can go to the next slide. And this is a few resources that you will also have on the slides that we use for different things. We have from CMS, we have from the U.S. Health and Human Services, the federal department. We have here we use the Mid-Atlantic Telehealth Resource Centers. That's our regional resource center. We have our own provided telehealth resources that we shared before, and UNC, that is the University of North Carolina Telehealth Information. You know, the UNC is one of the big health system here in North Carolina. Next slide, please. Questions. If you have any questions, I can answer some questions here. And I know that we have the platform, and I will try to answer the questions. And this is my co-worker, Dr. Roy McCardle, that she's our telehealth specialist, and we will take care of that question in the case that I cannot answer that today. So I didn't see the chat, so I don't know, Aislinn, if you have any question.
Yeah, thank you, Sebastian. Great presentation, lots of good resources shared. I did go ahead and post a PDF version of these slides. So they're now attached to this session in Whova. You can also find them under handouts in Whova. So if anybody's looking to access any of those links shared, they are now available. If you're looking for slides from our other sessions, some are posted by presenters. If not, we'll make them available as soon as possible. But yeah, these are now posted. If you refresh your Whova window, you'll see them under handouts. Yeah, so I do have a few questions submitted through Whova. I do want to encourage attendees to submit your questions now. If you have any for our presenter, Zoom or Whova is great. Either option, I'm prepared to read. So starting, there are some questions about bridging technology barriers for patients that are houseless. So do you have any suggestions or resources for dealing with the unhoused population?
I don't have experience exactly for, I guess it's for the, I guess anything related with houseless people is because I guess we don't have anything related with our office. But I will find out because, you know, the Health and Human Service Department has like a 19,000 employees and many, many divisions. I will find out what we have for that. But I know that it's not related, but at some point there are people that they don't have like established home. We have one of the biggest is a team from my office, one of the biggest farm worker health program. So this farm worker health, they're pretty much originally from Mexico, and we deal with all the immigration status, like a temporary visas and work, and we provide them the health for those farm workers. So we have in different funds to provide to them hotspots, laptops, tablets, and I guess they live in one place. So it's not exactly houseless, but they all live together. That's what I have for that. But I'm gonna go back to that question related to that population of houseless. Thank you.
Sounds good. Yeah, please, if you have additional resources to share as you come back, we'd love that. I know for CTRC, we do have some kind of resources and stories where some experiences have been shared to dealing with different populations. Okay, nothing in Cuba. So moving to Zoom, I'm going to ask the next question submitted from Teresa. Do you have any anecdotes that you can share from your community outreach and what services the community requested from telehealth?
Well, I can share some stories about related to the farm worker health program, because one of the main reasons at the beginning, they just want to be connected with their families. So that was, they were using the connection and the resources for that. And after that, we started to use telehealth. We have the good thing that will be pretty much a Hispanic population, and in that team, everybody is bilingual, so that's a big plus. I mean, I speak Spanish too, but I don't deal directly with that team. Right now, we have one employee that is going directly to the Native Americans populations in the west of the state. And I don't have any anecdote related to that, but the challenges is just I think what I mentioned before. At the beginning of telehealth, or not even at the beginning, I will say maybe let's say 6 or 7 years ago. Anything related with telehealth, it was expensive equipment that basically was a monitor with a camera that I cannot explain what those units, they cost more than $10,000 or $50,000. And that was like a lot of problems. I mean, and I saw places that they collect those old equipment and they didn't know how to use it. And that was a lot of money. So I'm fascinated with the new part of the telehealth. That is pretty much what we're doing. Everybody at home or in their office, they can do that. So you need basically a phone or a computer, and that's it. And for me, the best telehealth, because I think about, like, especially the elderly populations, I like the idea of just one click and that's it. I mean, there's many platforms that you can go from there. So basically, you receive a text message, you click, and you're connected. Otherwise, it's like a little complicated, even for us. You have download a platform, the easier the better. So that's the thing. So I hope that Teresa, I answer your question.
Thank you. Yeah, definitely keeping it simple is always the way to go.
Mhm.
I do have a new question asking just about, I think, in follow up to some of the resources and shared today. Curious from a general resident perspective, when it comes to getting local vulnerable populations aware and engaged in accessing services, what kind of strategies or programs does your office use? Feeling many of the individuals don't really know all that the government offers, and there can be a disconnect. So, how do you make that connection?
Well, I guess this is my personal thing, because the the department, a lot of things, they they just, they have the website, they have the things, but sometimes it's like a little more complicated, and people, they don't understand. Sometimes we talk with acronyms or
Mhm.
abbreviations, and uh, but we do what our team is try to understand the population. I mean, so in the case, for example, for the farm worker health program, the more you know them, I mean, not everybody who speaks Spanish is the same Spanish. So the more that you can accommodate to that, the more you're going to well receive. And there is some challenges, a lot of people, they love using WhatsApp, and in our case, being in government, we cannot do that, especially for promoting. But that's something that for me is interesting to see, or try to find a way, because that's what people use, and that's what that's what will make us more connected with the people in that case. And the more you know the population, the better. Of course, translated, make a translation. I mean, make sure that if you say you have like a mostly of like a um, for example, more people from let's say, or Mexico, more people from that. So try to make it like a more neutral and a good translation. And that's I don't think that people, they're gonna get offended or anything, but they're just gonna get like a more response if you are connected in a neutral way, because some translations or some ways to approach, they're like a little cold. And that's pretty much that's pretty much our secret. And of course, right now that we have this grant for digital literacy, we're gonna use more resources, and we're doing this in the way that we do it as a part of our regular job, but right now we're gonna use more resources, and I hope we can go like a little more professional. So I recommend anybody in this call that look for opportunities in digital literacy. Broadband access is like a little more complicated, because that will include that you have to work with a big agency. But if you can get anything like that, but digital literacy, that's where a lot of the grants are right now. So if you're gonna take care of that, where is gonna give you the grant, they will like that. So
Sounds good. Yeah. Definitely sensing the theme of, making it as easy as possible for that end user to really get them engaged in it. So anything that can be done to simplify the process, few clicks in their language. I don't know if you had a chance to attend any of the language sessions we had yesterday, but that was discussed for about an hour. We had some different perspectives on getting language and culturally competent care delivered in a few different modalities. So definitely worth exploring and seeing the best way for your patients and their specific needs. So a lot to consider. I'm doing a quick check to see if we have any further questions
well, I
submitted.
have one comment. Is from the provider point of view, and because the patient, they can be engaged, but if they don't know that it's like that they're having a medical appointment, they will feel I don't know, they're just calling me, they will feel like that something is missing.
Mhm.
So the secret is like for the provider, just make it like another regular visit. So the same respect that you have for the patient, the same communication.
Yeah.
Sometimes they have to, sometimes you have to make your notes. You can say, I mean, it's just the way that everybody can do it. But, there is some secrets to keep the patient engaged. Say, hey, it's not that I'm not going to pay attention or something, but I'm going to make some notes, but I'm listening, just to make the patient know that you're listening, but you're making notes. You're not just calling and seeing and explain that, this is like a benefit. So you don't have to travel. So it's not that we are like saving money with this. This is going to be a regular visit. So I want, the patient, you to feel comfortable. If at some point, if they just want to turn off the camera, I guess everybody in this call, they know that, but just like a little reminder.
Yeah. Always good to know. I know it does seem like, you would know, but I know everybody in the room here is probably somewhat of a telehealth professional, but we have our own, we call it a webside manner guide, because it's like, instead of doing that in-person bedside care, it's how do you connect via video? And it is like reminder to do those same things, remind them, I am taking notes, so I'm going to be looking away, but just making it so you're virtually still doing those same, hitting those same points. I do see a chat in from Crystal in Zoom, just reminding everyone of some resources provided from health center control networks for, cultural responsive tools. So always worth looking into HCCN resources as well. Great point. I know there's a lot out there. If anyone has any further questions for our speaker here today, we have some more time. Sebastian and Robin are also happy to take some questions offline. So if we don't get any more, then Sebastian, I'd just like to give you the floor if you have any final remarks for us or anything additional you'd like to add for our attendees today.
Well, what I mentioned before, please keep in mind it's not even the future, it's the present right now. So, but you're on time. Digital literacy, digital equity, those are the big areas that is going to take you to telehealth, not only a philosophical way, but it's going to take you with the funds to get a telehealth program successful.
Great. Thank you so much. Great conversations today. Lots of good resources shared. As a reminder, these slides are now available through the Whova platform. If you're looking at it in the agenda, you just scroll down to the bottom to find, I believe it's called materials and handouts and things. So it's under there. So join us for our next session happening shortly at 11:30. We'll be starting our next session. So please join us there for Making Telehealth Work, Insights from the California Safety Net. We've got a little break time here. So we'll see everyone at 11:30. Thank you again to Sebastian. Thank you for being with us today.
Well, thank you. Thank you, everybody, and enjoy the rest of the conference. Thank you.